We are here with Chris Roop, who is joining us at the CARE TA Center Cafecito. We are the Crisis and Recovery Enhancement TA Center. We are funded through the Mental Health Services Act to provide crisis continuum of care and justice diversion training and technical assistance to the MHSA funded behavioral health programs in counties across the state. And we are doing a series of informal conversations over a cup of coffee yes, cheers. Because in the shelter in place world, so many of us are missing the opportunity to just engage in a kind of relaxed, easygoing conversation in the staff lounge, essentially. A lot of really great stuff is shared in that kind of an environment. And we know that not everyone has time to jump on a 60 or 90-minute webinar. And so the idea of these cafecitos is a shorter conversation with experts and field thought leaders in the field. So we are thrilled to have Chris Roop joining us today. Chris, welcome. Would you tell us a little bit about who you are and what you do with NAMI Fresno, please?
Yes, thank you. I too am so excited to share a little bit about myself and NAMI's work with all of you. I am the executive director for the Fresno affiliate of NAMI, the National Alliance on Mental Illness. I've been in this work for 7 years, and I came out of a completely different background. It was the business and finance banking area. So this was a new area of work for me. I had a lot to learn, and I have enjoyed every bit of it since I've been here. Our affiliate has really, our presence has grown in our community since I've been here, and I'm quite proud of the work that we do. We, while delivering our programs to our community, from a lived experience perspective, because that's the core of NAMI's work. We're all walking this journey too. But the two big areas of focus that we really have been able to be a part of is some work in our education system, helping our youth understand the importance of mental health and recognizing when they need to reach for help and how to do that. But not just our youth, that's helping their families and their school support staff around them understand. And the other big area of work that we've been participating in for a few years now is our work with our first responder and law enforcement community and providing mental health training and support to them, again, from a lived experience perspective, helping them understand what this journey is really like to walk, and giving them some tools to be able to respond to crisis in the community.
Chris, this is exactly why I was so excited to have you join us. A number of counties across the state and frankly across the nation are really reconsidering and thinking about expanding existing projects and opening up new projects to really consider the interaction between law enforcement and people in the community who are experiencing mental health crises. I know that you've been doing some really fabulous work with the Memphis model of CIT. I wonder if you'd start by sharing a little bit about that work with us, please.
Yes, absolutely. You know, to date, we have taught 29 classes. Each class has somewhere roughly around an average of 20 to 25 first responders, mostly law enforcement first responders, but we do have EMS and fire participated in those. But we've also had at least about 600 officers go through our program. And that's been across about 16 different law enforcement agencies that have, and again, our other first responders included. And that's pretty remarkable. When we started this project, it really stemmed from wanting our local ambulance provider, American Ambulance, wanted to create a behavioral health response within their work. And so they explored a couple of different models of training that would be helpful to follow to create this response program. And the best model that fit that first responder area was the Memphis model. And the Memphis model was created in the late 80s in Memphis, Tennessee. It stemmed from a call for service that was made to a family with a loved one in a mental health crisis. And unfortunately, that ended in that loved one dying with that interaction. And I'm so grateful for the community's efforts at that time to come together and recognize the need to improve the response to mental health crisis in our community. Given the situations and the resources and tools that were there, what do we do? How do we help our officers? Because our officers are the ones called to respond to these calls. And a lot of dialogue about changing models, adapting in different areas. And I'm so grateful the conversation has evolved to that. But this particular model is still such a valuable model to use. When we delivered this to our paramedic EMS community, we invited other partners in the community, and law enforcement was one we invited in to come participate. A group of officers from our Fresno Police Department attended, and they were from our homeless task force. They loved the curriculum, the delivery of that curriculum, and they went back to the chief of police and others within their department and raved about it and said it was fantastic and others should participate. And so we were so fortunate that our former police chief, Jerry Dyer, decided that he wanted all of his uniformed patrol officers to have the 40-hour model, the Memphis model of crisis intervention training. And we set out on a path over 3 years with a project to get them trained. And it actually moved into 4 years. We were still working on that. The pandemic has changed the delivery because it is a very intensive delivery and training model. 40 hours is a lot. But the feedback we've gotten from not just our community members, but including our first responders has been amazing. We know this, we believe, because of all that feedback and the interaction, this is the best model to deliver when really looking at delivering crisis intervention training to your department. And we were very fortunate that it was delivered to the majority of the police department, because the Memphis model recommends 20 to 25% of your police force to be trained at this depth, because that's a lot. But it's so much better than what they learn in the academy or any other training opportunities they have. But to have almost your entire agency trained in this model, we have felt this difference in our community. Family members have told me they see the difference. And I am so grateful that NAMI is a part of the Memphis model. When it was created, the University of Memphis, Tennessee, the Memphis Police Department, and the affiliate with NAMI in that area came together and said, what can we do to do better? They created the curriculum of 40 hours, including community partners that are providers delivering services, the law enforcement agencies involved, and then the community voice, the lived experience voice. And that's NAMI. It's what we do best. And bringing us all together to deliver a tool to our first responders has such a powerful effect in crisis response when law enforcement is involved.
I am so impressed not only with the amount of participation that you've had in Fresno, but also that so quickly you're hearing from the community the impact of this training. And most importantly, from family members, to hear from family members, to hear from other people with lived experience as well. My gosh, there's no better affirmation, frankly, of that work. Could you talk a little bit about what types of feedback you received? Like, how is it different now in their interactions with law enforcement?
Yes, and that's an excellent question. We had just one example. I'll give you a couple though from various perspectives. A family member that is one of our trained teachers to lead one of our signature programs has a loved one that is living with serious mental illnesses and he moves around on the spectrum of the wellness of that illness. And at times, there may be years before calls for service are needed to help him with whatever his symptoms and crisis situations may be. She's contacted law enforcement in the past prior to us starting the training, and communication and assistance was difficult. And her words to describe it were, I felt like they didn't care, I felt like they didn't want to take the time, and I felt like they were frustrated that I made the call to come and help me and help my son. And then she had to call again a couple of years later, and we were about middle of the way with our training. And she called to tell me, "You'll never believe this, Chris. The officers that had to come out and help because my son is starting to have some serious symptoms, and I didn't know what else to do. The officers that were talking with me took their time. They listened to the things I had to share about his history, not just that moment in time, but beyond that. And then they asked me if I had been able to connect to any resources in the community where I could get some help as a family member. And did I know about an organization that was called NAMI?" And she just beamed with pride because in the moment of crisis, she's one of our teachers, and she hadn't reached to us for that support. And here was an officer reminding her about the value of connecting to your community partners for education and support, for more knowledge and guidance. And he didn't want to leave and just walk away giving nothing. And she said, I felt like they actually cared, that they really wanted to see him get connected to the appropriate place he needed to go at that particular moment in time. And that's key. That's absolutely key with this training, because the typical response we often think about, law enforcement comes out and it's an automatic involuntary hold, or the alternative to that would be in custody, taking someone to jail. Well, we really don't want either one of those if it's not necessary. We want to stay away from the custody side as much as we possibly can. And we know that the training, the knowledge that officers gain through this training, help them think differently. That's not the primary focus that they come into with. They are really coming in and thinking, where is the best resource in the community that this individual experiencing a crisis can go to for support? And if it's not this individual that we're connecting that one resource to, family members need support and guidance as well. So how can we help support them as well? And the intent is to reduce those calls for service from that crisis perspective by getting education involved, getting support involved, and making families aware of what resources do exist and how can they advocate for their loved one before that crisis call happens, hopefully diverting the crisis call entirely. The system's not always so easy to walk through. We're very aware of that. So again, connecting to partners is so, so important for all of our community members. And then officers, from their perspective, the first day we start this training, 40 hours, it's usually a PowerPoint structured. There is no tactical hands-on rolling around, use of their physical tools. And I remind them that, we have to be together, but I ask, how many of you are looking forward to the next 40 hours of training? And they're so honest with me, and I'm grateful for it. No hands go up. The newer officers, I have to say, I see a little bit more eagerness and interest initially, but we're working with a diverse group. But I connect with them and break down some of those barriers with sweet treats and, good conversation with them. But at the end of that 40 hours, they go back and I remind them of that first day that I asked that question and no one was really excited or eager about it. And I asked, though, now that you've completed it, how many of you are taking away something useful? You are more aware of mental health challenges. You're better prepared and aware of suicide. You've understood the importance of stigma and your role in reducing stigma. You now know about the different populations that and how it looks in those different age groups and different communities. You know about resources you didn't have any idea about. You understand the continuum of care for someone in crisis. You also understand mental health law better. You've learned some additional communication skills, or you are validated that your crisis communication techniques are helpful and you feel good, but you don't feel that you wasted your time in this training. How many of you feel this was valuable? And almost every hand in the room goes up. And it's just, I have goosebumps right now because every class this happens. Then you run into an officer in the community that recognizes me if I'm helping a family in crisis, and they recognize me. Oh, thank goodness Chris is here now, that Chris can talk to the family about this, and they will be connected to a resource. Or they'll tell us, I thought I'd never use it. I went through it because I was, told to attend the class, and I didn't think I'd ever use it, but I find myself using it every day. Those are powerful testimonies to hear. And when a loved one, our community members that live with mental illness, tell us they felt the compassion and patience so that they could actually share their crisis and feel that they were going to be helped, that's probably the best testimony, is from our consumer peer population. And I hear those, and it's heartwarming to know that all the people that came together to make this project come to life and give this tool to our whole community. It is one of the most heartwarming things for the county I'm in, Fresno County. I am so grateful for it and to be part of it.
You talk about the I don't remember exactly how you said, the shivers, or the feeling of,
goosebumps.
The goosebumps, right? The goosebumps. And Chris, that really resonates for me. I mean, thinking, in addition to the experience of family members and people who lived experience in the community who are saying this was really powerful, that officers themselves are not only saying that it was powerful, it was a positive experience, but that they're using these tools daily is incredible. My understanding is that officers who are forced to be de facto mobile crisis units or de facto mental health providers in the moment, that this is a profession that has a large amount of work, that there's never a dull moment for law enforcement. And so if we're able to connect people in the community who are experiencing mental health crisis with mental health crisis providers, my goodness, how wonderful it is to free up that time for law enforcement, and for them not to have to be in the position of what our mobile crisis units could do, what our crisis line workers and warm line workers could do. I wonder if you could talk a little bit about the shift that you see with officers who have had experience responding to mental health crises in the community, who are telling you in your sessions in real time, what is the most powerful part of the training for them? What speaks to them the most?
Another great question. And it warms my heart again to be able to tell you this part. In the training, we include the community member voice, and they hear NAMI's portion, which are two perspectives. We bring in a panel of family members and a panel of our consumers or peers. And we take, we take a period of time to share our story, the journey of what it's like to have a loved one living with mental health challenges, experiencing crisis, where law enforcement interaction was involved. And we're able to share the things that were helpful during those interactions and the things that were not so helpful during those interactions. And there isn't a purpose in telling anyone anything was done wrong. We're not trained law enforcement professionals, but we can share what didn't help for our family. And then our peer community And I've often been able to take my own lived experiences of interacting with law enforcement, having calls for service at my own home, and share the things that were helpful and the things that were not helpful in those interactions. And the purpose, again, is to educate and shine a light on a lived experience lens. But at the moment, we're not in a crisis. And crisis can be so many things. We go in with a focus of mental health crisis, but every one of us is just one event away from experiencing a crisis and needing a compassionate person with knowledge of resources to connect to, understanding the path to getting help, and that we're at our worst in that moment, but we are still people, and to be able to see the person past the crisis and the symptoms. And when we have a good little chunk of time, it's about 3 hours that we get to share stories. And law enforcement, any attendees are allowed to ask questions. We're open books. We want that dialogue, not just a delivery. And they're so grateful. They'll ask very relevant questions about medication, symptoms, decisions for treatment. And it's a wonderful, honest, very respectful and compassionate conversation that takes place. And then we do ask for feedback at the end. And the feedback we get repeatedly in all of these 29 classes is that they wish they had a full day of our lived experience stories, because this is where they pull all of the training together and they get to remember, they're reminded by these wonderful people telling their vulnerable stories that we're human beings. We sometimes live with things they never know of, and they arrive at the worst part of that. They see us at our worst, but they get to remember we're people. It's the person first to recall, and we have symptoms to address and work with. And that's pretty powerful to hear. They'd rather have more of us and our lived experience perspectives to hear from and learn from than any other part of it. And I'm grateful. I'm very, very grateful. And those individuals that are courageous enough to tell their stories, we tell hard parts about our stories, and we walk back through that. And our attendees, our officers, our EMS personnel, fire, whoever's attending, they're so grateful and extend that gratitude to any who share. It really, it helps the individual who's been in those situations realize their story is still very meaningful to help others.
What a powerful way to frame that, in terms of that the sharing of those lived experience stories is mutually beneficial. It's beneficial for the first responders who are in your training. It's also beneficial for the community members who are using their stories to make change and advocate for a culture shift.
Yeah.
And it's so powerful. I also got goosebumps again, Chris. This happens whenever I talk to you, because the work that you do is so powerful. To think about that person first perspective, and that who doesn't want to be seen as a whole person. And
Exactly.
in 2020 and 2021, by golly, I don't know a single one of us who hasn't experienced some pretty significant stress. And just like you said, any one of us could end up in a crisis.
Yes.
It's just a matter of human experience, and especially in this larger world that we're in. And so the way that you normalize and destigmatize, I think, is it's reminding me that the work that you all do benefits everybody in society, not just the people who end up calling for 911.
Yes.
Not just the people who end up responding to those calls, not just the people who are the folks who are having the crisis and their family and friends. I wonder, we've received a number of TA requests from counties who are saying, okay, they want to either build out existing programs for crisis response, or these might be programs that they have in existence, or they're looking at multiple models. And I don't know the answer to this, so I'm really excited to learn from you. I wonder, it seems to me like the Memphis model can actually be used side by side with in a county where there's also a mobile crisis unit, that the mobile crisis unit, which typically will have a provider, maybe a licensed clinician and a peer specialist who go out on scene. But even those mobile crisis units who are not staffed by officers, if there's a situation of imminent risk, especially to others, they might end up calling for backup from police force. So if
Yes.
they call for a police force backup, or if they call for, and they are ended up connected to the fire department, for example, it's still a really good idea to have had those first responders trained. Am I tracking this properly, or is it one
Yes.
or the other?
Yes, absolutely you are. Well, we have worked over the last few years to deliver this training to our first responder community. We've also been able to um, have a crisis intervention team created. So this specialty team within Fresno Police Department. We also have a mental health crisis clinician program in our community. So we gave our officers this tool because when someone makes a call for a crisis situation, they're not always prepared to deliver that it is a mental health crisis. Our community member society is when something is wrong or we're frightened or we need help, we are conditioned to call 911 to help us. And so as long as we have that behavior that still exists, I think these programs they just go hand in hand. They partner and blend together so well. They support each other. There are many times that mental health clinicians response, a mobile crisis team that is a crisis clinician can respond. But when we have to bring in our first responder community for various reasons, we want them prepared when interacting in that situation. And, I speak with families so frequently, and I learn that not everybody knows to say mental health challenge, mental illness. I'll have families, for example, use a phrase, my loved one or my child, they're acting out. They're acting out. That's a phrase I've heard more frequent lately. And I had to dig a little to find out, what do we mean by acting out? Can you describe the behavior? And indeed, they were behaviors that would be mental health related. But if you make a 911 call, and our wonderful dispatch community is excellent at digging deeper, diving deeper. But if someone isn't prepared to deliver that language, we still may have law enforcement responding. And they may be responding to a criminal crisis situation where members of the community are involved and around that may be triggered and experience a mental health crisis too. And they are the first there. So we want them to have these tools and resources to be prepared at any time when they are faced with it to deliver the best response that keeps everyone safe. That's the point. The point of CIT is CIT saves lives, and trained officers with great communication and de-escalation skills, knowledge of resources, awareness of what to look for, remembering the importance of this, that reducing stigma. This is how we better our communities when we collaborate and we have various options. I would encourage any county considering developing crisis response to consider options versus one rigid structure, because your communities are diverse as well. We have to take into account the socioeconomic components, the cultural diversities, language barriers. We want to honor our community, and we want everyone to have equitable response. Well, we do that when we have a variety of those things. That is it. To me, that's how we respond best and keep our entire community safe, all parties involved.
I tend to learn so much from you, Chris. I really appreciate how you talked about the definition of acting out I've worked as a social worker and just someone in community. I have interacted with people who sometimes have really scary thoughts.
Yes.
It just happens. They have scary thoughts, and it's hard sometimes to figure out if what they're hearing or seeing is something that other people hear and see. And any one of us, if we feel that we are being threatened, can act in ways to protect ourselves. And to the outside world, if they don't know what's going on inside of ourselves, what we're reacting to, it can look any number of ways. And so, gosh, what you said, I just keep processing this idea that family members or community members, somebody on the street, wouldn't necessarily know to say, this is a person who's living with this condition or what have you. And that the other piece that you talked about is that we are still in a culture where people call 911. Later this year, we will have 988 rolled out for the
I
first
know,
time.
I'm excited.
Exciting.
Very.
So for folks who might not be familiar, 988 is going to be a behavioral health crisis line. It's a national line that will be separate from 911. But it's going to take a culture shift. Just like we're talking about a culture shift in first responders, it's going to take a culture shift in those of us in the community to think, let me call 988 rather than 911. So we have so many moving parts that are happening simultaneously. I think we're at a really exciting point in crisis continuum of care development. But I love that what you said, that we want to have multiple approaches that bring everybody into the fold and really think critically about issues of diversity, equity, and inclusion, and what's going to be the most accessible and relatable for people as well. I know for some people, having law enforcement arrive or having fire department arrive might create a sense of safety. Like, okay, there's somebody here who can make sure that any criminal behavior that might be happening can be addressed. And then there were other communities who have had experiences recently with immigration services, for example, who might be scared that if they see law enforcement arrive, they don't know whether or not people will start to look at immigration papers or documentation. So I really appreciate what you were talking about the cultural diversity side. I guess as my final question to you, I wonder if you could just talk a little bit about both how the Memphis model kind of thinks about cultural diversity, and then finally, for any counties who would like more information about the Memphis model, who and where they might first go to find out.
Yes. Okay, wonderful. So within the Memphis model, again, it's 40 hours of curriculum, and one of the components for the curriculum includes a cultural awareness panel. So we do bring in members of our community that are representative of our diverse population, and they're able to share how their culture perceives and addresses mental health challenges, whether it's acknowledged or how deeply stigmatized it may be, the lack of language that may exist for it. They also talk about how their culture perceives authority and law enforcement and first responders. They can share their own experiences that they may have had. It's very much another lived experience panel. And again, the shares are not to say every member in my community, in my cultural or ethnic population believes this. It's, I belong to this community and here's my experience. This is what I know. And giving some thought for our law enforcement officers to really remember talking about different cultural practices as well when first responders have to arrive in certain situations in someone's home, the importance of gender, the importance of the roles and responsibilities of different family members, and who we address and how we address them to maintain respect and dignity for everybody involved in times of crisis situations. And I'm grateful that that gets to be included because our officers are diverse as well, and they're able to share their experiences back to the presenters, the panelists. And so it's always a dialogue that takes place. And in every class, I've sat in all of them, and I always take things away during the cultural panel, things that are just helpful things to be aware of when I'm interacting with different family members, but also just very interesting facts that I receive from an education perspective, almost trivia, if you will, that I get to take back. And I just feel that I grew from it. And so I'm always grateful for, again, the panels that can come in and share. And then more information, I would encourage you to search for CIT, I believe it's CIT International in your web browser. It will take you to learn more about the Memphis model of crisis intervention training, how you can start these programs in your very own communities. I encourage you to make it inclusive of your partners. There isn't one particular organization that can deliver this program. We have 12 instructors with ours. 12 different people. In addition to those 12 people, we have some other partners from those areas in case someone needs to step out for a training session. So it's really building the capacity of that. But you bring forth this knowledge and you demonstrate to your officers that it is a partnership, it is a collaboration in your community. And what one of the unexpected benefits of this, when we take officers out into the community to do site visits and they hear from our stories and learn about resources, they learn what may need to change. And our crisis response needs to be reevaluated. We need to evolve from this, and we need to find the best, safest ways to do this for our communities. And our first responder community can be some of our most powerful advocates. And they can do that very effectively when they're aware of how the system really works, when they're aware of gaps that may exist, when they're aware, and they only learn of this when they hear our stories. It's really easy to say, why didn't you do this? Or you should just go here. But if they don't really understand the process of how that all works, where we need to build supports and bridges, then we are missing a very, very large, powerful group that can advocate on our behalf, because we don't want them to be our mental health professionals in the field. We want them responding to crime and keeping our communities safe. So now let's use your voice, law enforcement, first responder community, to help us affect more change to better the system of care for us who need it.
I am so grateful to you, Chris. Thank you for this incredible look into the CIT model from the Memphis perspective of the Memphis model of the CIT program. I really appreciate that you would take the time to share your expertise. Congratulations as well for the incredible success that you have.
Thank you.
Fresno is really lucky to have you at the helm of Fresno NAMI California's chapter. And for anyone who found this to be as insightful and inspiring as I do, we are very fortunate that we're planning out a full webinar with Chris that will be coming out in the next couple of months. So please do stay tuned. We will put in the comment section the link to Fresno NAMI California if you would like to check out their chapter. We'll also put in the link for a CIT program and also for the CARE TA Center. So thank you so much, Chris. And to everyone in the audience, thank you for your work as well. Thank you.
Thank you.